Regular physical activity is one of the most powerful tools we have for better health. We're speaking with diabetes care and education specialist Michael C. about the role of exercise in managing type 2 diabetes. Diabetes Primetime is brought to you by Reliant Community, an amazing program available exclusively for Walmart customers with a Reliant Premier meter. Get free diabetes tips, recipes, and support sent right to your phone. Just click the link in the comments to learn more. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Michael, thank you so much for being here with us.
Oh, Ainsley, grateful to have the opportunity to talk with you today.
So when it comes to blood sugar specifically, how does exercise help manage glucose levels, both right after the activity and then also over the long term?
Physical activity and exercise is like insulin. It kind of physical activity makes our body more sensitive to glucose. And we store glucose primarily in our muscles and our liver, and in fat. But, the more active we are, the more we use our muscles through different types of activities, the more sensitive we become to glucose. So that's why people can see real favorable impact of movement on their blood sugar.
So I have to ask, we hear this question a lot on the page. Can physical activity help prevent or maybe even put type 2 diabetes into remission? What does the science say about that?
Certainly, when we look at diabetes prevention, some of your listeners may be familiar with the DPP or Diabetes Prevention Program. And at the foundation of that was physical activity, or 150 minutes of weekly activity. And, a program in conjunction with, nutritional changes and other things that go with a healthy lifestyle can, for many people, prevent or delay the onset of diabetes. And that's what the Diabetes Prevention Program showed.
So one of the reasons that can happen is because exercise improves insulin sensitivity. Tell us what that means and why it happens.
Many people with diabetes have what we call insulin resistance for various reasons. And so, with physical activity, we become more insulin sensitive, and we're able to, our body's able to store glucose in our muscles as opposed to having it circulating around in our body. So when we check our blood finger or we look at our CGM and we see our blood sugars are high, that's because our blood sugars are elevated. We have more sugar circulating in our body than we want. And so activity helps us with storing glucose in our muscles, in other parts of our body, and in our liver.
So what I think I hear you saying is that exercise can help our bodies use the insulin it makes more efficiently to pull sugar out of the blood and into our muscles where it can be doing good work.
In simplistic terms, that's exactly what physical activity and using our muscles and moving our body does for our glucose.
We're going to pause here and do our trivia question. If you answer this question, folks, you'll get our 1-week exercise guide that gives you different ideas for activity over the course of 7 days, and you'll get it for free if you answer this question, which is, true or false, just 10 minutes of walking after a meal can help lower blood sugar. Is that true or false? Can 10 minutes of walking after a meal help lower blood sugar? Put your best guess in the comments, and you'll get that exercise guide delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. Michael, when we talk about exercise, there are so many options: cardio, strength training, flexibility. Are certain types of activity more effective than others for people with type 2 diabetes?
Aerobic exercise is more for our cardiovascular system, our heart, our blood vessels, are enhancing our stamina and endurance. Muscle strengthening is more focused on developing our muscle strength and function. And, balance and flexibility is more around, for certain individuals that may be at risk of falls or, flexibility, focusing on, movement. So they all have complementary benefits. So I don't think one is better than the other. We would individualize it depend upon the person. I have clients that I really focus only on strength because they're older and their function is compromised. Some people I work with, want to, run 10Ks and do long bike rides. So focusing more on cardiovascular fitness. So they all have benefit in terms of health and well-being and in terms of management and prevention of diabetes.
So, in general, how often and for how long should someone with type 2 diabetes aim to be active each week?
Certainly the recommendations are 150 minutes of moderate intensity physical activity done on most days of the week, or 75 minutes of more vigorous activity performed in bouts of 10 minutes or longer. And those are the recommendations for cardiovascular exercise, aerobic exercise, activities that increase our heart rate, our breathing. So, one should work their way up to 30 minutes of activity most days of the week in bouts of 10 minutes or more.
So, is this one of those scenarios where whatever we can do is better than nothing? Like, it's not like if we can't do 150 minutes in a given week, we shouldn't try at all?
Yeah, exactly. The years ago when I had gotten into this field, it was kind of etched in stone, but we realized that, physical activity and exercise has a dose response benefit, right? Some is better than none, more is better than some. And for certain people, too much too fast can be detrimental. So that's exactly what it is. Find activity that you enjoy and kind of evolve from there.
So, is there a best time of day to exercise for managing blood sugar levels, or does it really just vary from person to person?
Certainly your personal preference and your schedule. People have demanding schedules and are very busy, and they're not always able to carve out time at the ideal time. But as you mentioned earlier, certainly first thing in the morning, depending upon particularly people that are on insulin therapy, first thing in the morning is an excellent time. It reduces the risk of experiencing low blood sugars. And then after meals are a great way to attenuate any rise in blood sugar that you may feel, you may experience after meals. So activities after meals is great. And, limiting time for people on insulin therapy, limiting, extended physical activity when you've taken insulin and it's peaking in your body, because that can really put you at greater risk of hypoglycemia, which can be really disconcerting. Here I want to exercise, I want to be active, but now I'm handling a low, and it's frustrating.
For someone who hasn't been active in a while, what's a safe and realistic way to start exercising without overdoing it?
Not one size fits all, but I would start by taking a walk if you're able to walk, or finding an activity that you're available. Right now, you can go on to YouTube and find beginner exercise classes, recordings, or stretch classes. So do a little research and start out with a goal that you can't fail in achieving, right? I'm going to go for a 5-minute walk around my house, and then celebrate your success and, build upon that. How was that? Oh, I could do that. That was no problem. Next time, 5 minutes, and build up to a level that you feel comfortable. The key is not to overdo it and to finish like, boy, I could do more and I want to do more. And so you're going into that next bout and say, hey, I was successful yesterday or this morning on that 3-minute walk. I can do it again.
Absolutely. So important. And do you recommend that people check blood glucose before and after physical activity?
Oh, yeah. It's critical that, you understand what your blood sugar is at. So taking your blood sugar perhaps 30 or 60 minutes prior to planned exercise, and then right before. And so now you have kind of two reference points. My blood sugar was 180 uh, 45 minutes ago. Now it's 170. So I'm holding steady. Or it was 180 and now it's 110. So I'm trending down pretty rapidly. So I need to take some action. I need to maybe have some juice or take some glucose tablets to so my blood sugar. So depend upon whether you use CGM or you use a meter, monitoring your blood sugar is critical. Not relying on symptoms. Some people may have, sweats or shakes from low blood sugars, but you may not recognize those in the setting of, exercise.
In case you're just joining us, we're here with diabetes care and education specialist Michael C., talking about the powerful role of exercise in managing type 2 diabetes. And we're giving away our 1-week exercise guide if you answer our trivia question, which is, true or false, just 10 minutes of walking after a meal can help lower blood sugar. Is that true or false? Can 10 minutes of walking after a meal help lower blood sugar? Put your best guess in the comments and you'll get our 7-day exercise plan delivered to your Facebook Messenger inbox for free. Folks, we do this show every month and we want to make sure you never miss an episode. Like and follow us on Facebook and we'll keep you up to date. So Michael, many of our viewers face issues like neuropathy, joint pain, or low mobility. Is it possible to work around those challenges and still create an effective exercise plan?
Do you look at that as a problem or an opportunity? Right? If it's an opportunity to tailor your exercise program to meet your unique challenges you may have, then of course you can. Yeah, I mean, for people that have neuropathy, low impact or non-impact activities, chair exercises, water exercise, different types of equipment can be tailored to the individual. If you look at that, I can't exercise because of this problem I have, then it's going to be a problem. But in many instances, you can overcome those challenges. Now, you may need to consult with somebody that can come up with strategies to approach, but often you have your own answers. Somebody just needs to ask you the questions. What have you done in the past? What do you enjoy doing? If you had 3 wishes about activity, what might they be? And then just exploring those.
Oh, that's very inspiring. And I think sometimes we don't talk enough about the mental health benefits of exercise. And I don't mean in terms of like there's less depression, anxiety, but actually like after you do some exercise, you feel so much better. It can lift your mood. And so I'm really glad to hear you say that it's accessible for everyone. It just may involve asking a few questions, getting some help, and then getting underway.
How we frame things is so important. Often people will say, oh, I did that 15-minute walk, but I really need to do 30. Like there's some golden rule. But no, frame that in your own ways, reframe that in positive. I did 15 minutes and I really feel good. Next time, if time allows or whatever, I'm going to try to do 20 or 30. So how you frame it, that self-talk that you mentioned, is so important. And so reframing is important. And I do that a lot with my clients because it's human nature to have a negative bias and to say, I always could have done more. I could have done better. But that's not really, that's more self-defeating than raising you up and exciting you about what lies ahead.
So Michael, what's one common myth about exercise and diabetes that you'd like to set straight?
That there's a perfect program. That there's only one program that's ideal. And if you're not doing that, you're not successful. No, the perfect program is the one that you'll do and that you enjoy and that you want to come back to and do again. I was this past weekend, I was at the Breakthrough T1D walk in Boston. And I tell you, everybody had a smile on their face. There wasn't one frown. They were with other people, family, friends, or just people walking along the way. And I guarantee that at the end of that walk, they were like, if you asked them, how did you feel about yourself walking? They would be like, that was really fun. That was enjoyable. And so, find us. There's no one program that's ideal for everybody. Find what works for you. And if you try something and it didn't work for you, try something else. Generally doing it with people that support you, that make it enjoyable, that raise you up, is better than, that you finish leaving wanting more, or said that wasn't bad, as opposed to being totally exhausted.
Okay, for someone who's newly diagnosed with type 2 diabetes, who's listening to you and saying, okay, I'm ready to give this a try, what's a good first step they can take to begin building more activity into their routine?
One thing would be, take every hour, get up, depend upon the nature of your day, right? If you're sitting at a desk, get up and walk for 1 minute. That may be the first step. But I would really ask the person. It's usually we have the answers. Nobody else has the answers. We're the expert in our own lives. So I would just ask, if you have this desire to be more active, what does that look like? Paint a picture for me. Now there may be silence for a long period of time, which seems like a long period, generally only 15 or 30 seconds. And they may say, I could walk after dinner. Okay. Or I used to like to shoot baskets. Okay. Tell me more about that. So, usually most people have the answers. We just need to ask the right questions. And then, have them come up with a plan and, kind of hold them accountable. Somebody needs to hold them accountable. So I would have them share that with a loved one. Okay, who are you going to tell? Who's going to be accountable that you're going to walk after dinner? I'll tell my wife. I'll tell my wife. Okay. Who will support you on your journey to being more active? My coworker is really active. He walks at lunch. Maybe I'll ask him to support me or have me walk with him. So it may that conversation may be like that, and less is more in those instances.
So, Michael, we're going to change gears here a little bit and talk about health and well-being coaching. What is health and well-being coaching, and how is it different from what a person might receive from their healthcare provider or their diabetes educator?
A number of years ago, working in clinic and healthcare settings, I learned that most of the time I was creating my own agenda with the clients that I met, and not really addressing their needs. And that's commonplace in healthcare. And so people would walk away with information that they wanted or didn't necessarily want. And we know that knowing and not doing is the same as not knowing. So I decided to get into the coaching space and really understand how people change their lifestyle habits. And so that's what coaching is really understand behavior change theories and strategies, and working with my clients in that they create their agenda. What is it that they want to talk about? What is it that they want to learn about in their diabetes self-management or in their general health and well-being? So those strategies are different than, giving people a handout or telling people the hundreds of things that we tell people about diabetes self-management. So that's really what health coaching is. is meeting people at where they're at in their journey, letting them set the agenda, and working with them so that they can be their best self, their healthiest self.
And I'm curious to know how it can benefit a person, whether they're living with diabetes and or whether they want to achieve specific health goals.
What I want to know is what you want to know and what you want to do in your journey. And so really identifying that and, and having conversations and providing the skills, the knowledge, the education that you want. It does you no good if I'm telling you information that you don't really value or prioritize. And so a lot of people will come in and, in terms of their diabetes self-care, they have something unrelated that they want. Maybe they're dealing with stress and their stress isn't allowing them to really take control of their diabetes. So if we don't address that underlying issue of stress and how to best handle it, how are they going to take care of their diabetes? Or maybe their resources, or maybe they don't have access to, supplies, or they don't have access to, healthy food. So really, if we don't address those underlying concerns, then, in meeting the client where they're at, then all the other information is really irrelevant.
So, what strategies are used in health and well-being coaching?
It's as simple as an open-ended question, right? Often, like, tell me what you've done well in your diabetes self-care. Where are you really excelling? What are you really proud of? And then on the flip side, perhaps, where are you being challenged? What concerns you? Or I would just say, at the end of our visit today, if you could say this was a wonderful experience, what would need to happen? What do you want to leave our session today, our appointment today with? So these open-ended questions, and you'll often find in a coaching setting or in even a good clinical setting that the provider is asking these open-ended questions, and you're doing more of the talking, because what's most important is your experience, is your relationship with your health and your diabetes.
I love that the first question you asked was like, what are you doing really well with diabetes management? Because I think often in our self-talk and in the conversations we have with healthcare professionals, we often focus on the things that aren't working. So I just love that as a prompt for folks watching at home, like, let's start with the positive. Let's start with what you are doing well before we turn to like, what could be improved? What are we not loving right now?
Although we tend to have a negative, this inner critic you talk about, can be really tough on ourselves, right? What we're not doing. And we get that in our healthcare setting too. Your A1C is high, or this is what's not working. But when we start to focus on what's working, we sit up straight, we take pride, and we feel better about ourselves, and we can move forward better. We're more apt to make positive change.
So how can AI be used in health and well-being coaching?
Health coaching or health care is episodic in nature, right? I meet with my doctor every 6 months, or my healthcare team. I meet with my coach perhaps one or twice a month for a half hour. But in the interim, having, in the case of the AI assistant coach that I've developed, you get 24/7 access to support. And so you could check in with your AI coach. In my case, her name is Zoe, or his name is Zoe, and working together with your human coach, somebody like me, and your AI coach, you get 24-hour, 365 access to support. And so it's just really a powerful tool. And in the case of this platform, you may have questions. You may say, I'm doing an exercise session, and how to best handle my blood sugar. And you could put that in and you can get some information, but also me as your coach or your coach can provide you with some additional guidelines that can be very individualized.
Michael, thank you so much for joining us tonight. This has been such a helpful and inspiring conversation.
Oh, I appreciate the time, Ainsley, and I hope your listeners can walk away with one thing to achieving their goals.
Well, I know the one thing I'm going to be walking away from is that it's the quality of the questions we ask ourselves that really determines kind of what happens. And I love your suggestion that we know our lives, we know what matters to us, and a lot of the answers we have are inside. So thank you again. And a big thank you to everyone watching at home. We always appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, just 10 minutes of walking after a meal can help lower blood sugar? The answer is true. If you didn't get to answer the trivia question, but you'd still like that awesome exercise guide, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.